G'day everyone, this is Health Highlights. Health Highlights is a show about health professionals and the people and the stories behind the names we hear about but we seldom get to meet. And I don't know if you realise or not, but there's a lot of talk at the moment around our community about gut health and what that looks like and how important it is to our health. And so today, it is a great privilege to have Dr. Tim Walker with us. Welcome, Tim.
Lovely to be with you.
Tim is a gastroenterologist who works in the public system around the whole Hunter region, and is also a senior lecturer at the University of Newcastle, lecturing on all things to do with gut and gut health. So welcome, Tim, thanks for joining us.
Lovely to be with you.
Can you just firstly tell us, gut health, it is such a big issue, and they actually say that 70% of the immunity of our body is actually in our gut. Now, is that true? And if so, what's the science behind all that?
Yeah, great. Thanks for a fantastic lead-in, Simon. It's great to be with you. When we talk about gut health, I mean, the first thing we think about is that the gut really has a very big surface area. You know, it's kind of 5 meters long, and you've got all of these microorganisms living in your gut. They actually outnumber the cells in your body, if you believe it.
Wow.
And because the gut lining is really thin, it's not like our skin, which is kind of waterproof. It has to be able to let stuff through. And so we do have a very large immune system in our gut, and it probably does make up about 70% of our immune cells are actually in our gut, trying to keep that under control. And so we sort of live in this balance where we've got a large number of microorganisms that we need living in our gut, but we need to keep the balance right between what we put into our bodies, what's going on inside, and that really has a large effect on how we feel.
Yeah, wow. Okay. Well, there you go. That's something that I'm very interested to know a bit more about. But firstly, can you just tell us, gastroenterologist, what actually is it that you guys do every day? Just so that our viewers can sort of hear, a snapshot of your day.
Yeah, so I work in a public health system, and so a lot of my time is spent doing clinical care, caring for patients. So I look after what we call inpatients, which means people are in hospital. Maybe they've got a major problem and need to come into hospital for a time, or they need to come in and have a procedure, a gastroscopy or a colonoscopy, where we look around the bowel and see what's going on in there. So I do that as well. We also have outpatient clinics, so we take referrals from general practitioners around Newcastle and around the greater Hunter region, people who might need to see a specialist because they're having trouble with their gut. And we also, although I do a lot of gut work, I also do look after patients with liver disease, and that's something we might come to later. Okay.
And so, why? How did you get into this area? Why did you sort of go down the path of gut health and becoming a gastroenterologist? Is there a particular passion you have for this area, or is it just sort of the way things sort of worked out for you?
Yeah, so I'm really passionate about teaching and learning. It's one of the things I really enjoy. And working in a public hospital, I get to spend a lot of time training junior doctors, working with our whole allied health team, so nurses, physiotherapists, a whole lot of other people are involved in the care of our patients. So that's something I really enjoy, is being part of a team. One of the nice things about gastroenterology is that you really have this mix of different roles. So you look after patients in hospital, I see patients outside, I get to come and do interviews like this sometimes, maybe go and teach at the university, do a bit of research as well. And so it's a really varied profession. I really enjoy having different things in my day. So that's one of the things I love about it.
Okay, so back to the gut health. So what would you say to the general person? What was some of your hot tips about actually getting or keeping really good gut health?
Yeah, so I think when we think about gut health, a lot of the themes of gut health are similar to themes we talk about with your general health. So diet is really, really important. What you're eating determines what mix of microorganisms you're going to have in your gut. And if you get unwell and you have other illnesses, you get stressed, all of those things are going to affect your gut health. One thing that's talked about a lot in our community is antibiotics, and people are having antibiotics more in the last 100 years than ever before. And because of that, our gut flora, the bacteria that live in our gut, get really affected by that, and that can have knock-on effects through our health.
And so, how do you replenish your gut? If you've had antibiotics, or you've had even gastro, for example, how do you actually help restore some of that gut flora that maybe have been lost?
Yeah, so when people have gastro or they have other illnesses, a lot of a lot of the time, what they really need to do is just get back onto a good, healthy diet. So it's the kind of things that you hear generally from health promotion. So lots of fruit, lots of vegetables, staying away or limiting the amount of processed foods you eat. Probably our diet tends to be pretty rich in meat, and so reducing the amount of meat and kind of spending a lot more time, I guess, in the vegetables like Coles or Woolies is a really good idea for your gut.
And probiotics, is that something that you recommend or you see as helpful?
Yeah, it's an interesting area. If you actually look at all the bacteria in our gut, we only know what about 5% of them are, and there's another 20 or 30% that we might know a bit about what they do. So kind of 2/3 of the bacteria in our gut, we don't have any idea what's going on.
Wow.
And it's a really complex system. So it's a bit like people you see those ads where you see the good bacteria and the bad bacteria and one lot shooting the other lot for various probiotic products. We don't actually know what the good bacteria and the bad bacteria are. And in fact, the whole system's probably much more complicated than that. It's a bit more like a rainforest or something where there's all sorts of different animals, all sorts of different bacteria in our guts. And they're great if they're in the right place and in the right numbers. And if there's too many of them or they're in the wrong place, then that's when we start to have problems.
Okay, wow. And so let's go on. There's probably 3 big areas, if you like, around gastrointestinal health that we want to address. So that is reflux, irritable bowel, and bowel cancer. So let's just start with irritable bowel. So that's something that is just so prevalent in our community now. Would you say that's an overdiagnosed condition today?
Yeah, I mean, overdiagnosed, it's a little bit tricky, isn't it? Because we trust what our doctors tell us, hopefully. And, I don't think that the condition's overdiagnosed, but I do think that if you actually think about what irritable bowel means, it means that there's a link between our emotional state and kind of what's going on in our lives and how we perceive that in terms of our gut health. And I think if you think even about the English language, which is long-standing, we've always had those expressions in English. That was a real kick in the guts, we say, don't we?
That's right.
And what that really means is that when something goes wrong, it hurts. It can give you pain in your guts. And so we've medicalised that and we've called that irritable bowel. But actually, I think that's always been present right through history, and I think our language sort of reflects that. That we talk about our emotions a lot in terms of gut symptoms.
And so it seems to be such a prevalent condition. Is the reason for that because of the stressful societies that we live in, so therefore it reflects in our gut, or is there other reasons why maybe it's more so now than maybe has been in the past, or do you think that's really not the case? It's pretty much always been in our communities.
I mean, I think there are factors that are making it more prevalent. I think that the amount of processed food we eat is probably not good. And there's been some more research looking at things like emulsifiers in foods, which are basically things designed to make your mayonnaise look like mayonnaise rather than a mixture of kind of oily stuff and water. And those emulsifiers are kind of like detergents. They're a bit like your dishwashing detergent. And they have major effects on the barrier in the gut. And we're still in the early days of understanding how this works, but it looks like that might contribute to some of the symptoms people have, and it may even contribute to more significant or more serious inflammatory conditions in the bowel, like inflammatory bowel disease, maybe even celiac disease.
And that leads to my next question. So if you've got someone out there who's thinking maybe they've got irritable bowel or they've got something going on, what are the signs and symptoms that they should be looking for to maybe go and see a doctor or go and see someone to get a diagnosis?
Yeah, so when we talk about irritable bowel, it's what we call a diagnosis of exclusion. And what that means is we don't say somebody has irritable bowel until we rule out serious things.
Okay.
So in a way, I'd turn that question around actually and say, what are the things you should be worried about and what you should be seeing your doctor about as a matter of urgency?
Absolutely.
And so things like weight loss, like a significant change in your bowel habit, maybe you've always been constipated and suddenly you've got diarrhea, or the other way around. People who've got a family history of inflammatory conditions of the bowel or colon cancer in the family. These are the sort of situations where you shouldn't be waiting. You should be going to your doctor and you should be getting checked out properly.
Okay, and so let's say someone has a diagnosis of irritable bowel and they've gone through that checklist. What is your advice to those people about actually helping their irritable bowel and some of the things they can do to actually sort of support their condition?
Yeah, great. So, I mean, as I said, the first thing is I always tell people is don't self-diagnose, because we need to make sure that we've ruled out all those other serious things.
Yep.
And so we put that to one side and say, where do I start when I'm talking to someone with irritable bowel? What I normally start is that kind of discussion we've been having about the link between emotional health and gut health.
Yep.
And I think people often, when I talk to people, I often find that there's stressful things that are going on in their lives, and maybe that's been contributing to their gut symptoms. And when people stop and reflect, some of those people even keep a sort of symptom diary where they write down their gut symptoms and what's going on in their life. And often people can actually understand that there's a link between what's going on out there in the world and what's happening in their lives and how it's making them feel. So kind of a mindfulness approach can be actually really helpful in this area.
That's great.
The other thing is diet.
Yep.
I talked about sort of processed foods in diet, but there's some more recent research looking at what's called a low FODMAP diet. That's FODMAP. It stands for a whole lot of different sorts of sugars that aren't well digested in our gut, and they can cause bloating and pain as they come through the bowel. And so sometimes people are put onto a low FODMAP diet in an effort to try and reduce some of their irritable bowel symptoms. It's not something you should be doing for yourself, though. It's really something you should be going and seeing your doctor and really discussing with them, because there can be some harm in taking a low FODMAP diet for too long.
Yep. Okay.
Obviously, I always tell people they should be investigating alarm symptoms, and as a last line thing, there are medications that we sometimes use to help, either with pain or with constipation, some of the symptoms that are common for patients with irritable bowel.
Wonderful, that's great information, I'm sure, for everybody. So now the other probably more serious condition is bowel cancer. We have heard a lot about that. What is the latest on bowel cancer, the latest research around bowel cancer, and what is your recommendations to everyone out there about getting it checked and what signs to look out for with it?
Yeah, great. Thanks for the question. So, bowel cancer is really common in our community. It's the second commonest cancer for women and the third commonest for men.
Wow.
And although the incidence is actually, the kind of rate of cancer in the community has gone down a little bit over recent years, and as well, people are surviving more with bowel cancer, which is great. We still need to be on the lookout for this, because it's a pretty common cancer in our community. When I think about the things that put people at risk, there's the kind of things about the person, about who we are and where we come from. So things like our family history, whether we've got a family history of bowel cancer. There's some genetic things, and sometimes we have to get expert geneticists involved when people get bowel cancer really early.
Yep.
So if that's something that's happened in your family, you definitely should be having a chat with your doctor.
Yep.
But then there's the things about the environment that we live in and the way we live as well. So things like smoking and alcohol are associated with increased risk of bowel cancer. And more recently, there was some publicity in the news about eating lots of red meat or lots of processed meat. And that's probably not good. That probably increases your risk of bowel cancer a little bit. It's not like if you have one piece of salami, you're going to die.
Yes.
But it sort of probably increases your risk by between 1.5 and 2 times if you have lots of processed meat.
Okay.
So that's a significant thing for people to know about.
Absolutely, and look, we were talking before, and there's some new medication, I believe, that's come out about Hep C. So maybe do you want to just share with everyone a little bit about the new advancements in Hep C and what that is doing for people with that condition?
Yeah, great. So hepatitis C is a condition that has been really prevalent in our community, and yet we haven't been great at diagnosing it, and when we have diagnosed it, the treatment has been quite difficult. It's involved lots of injections over a long period of time, and success rates haven't been that good. The other challenge has been that the medications that we used before had significant side effects on people's mood, and so people were pretty reluctant to take those treatments.
Yep.
What's happened in the last few years is that we've got a whole new generation of treatments for hepatitis C. They're once-a-day tablets. They involve taking a tablet once a day for around about 2 or 3 months, typically, for most patients. And they result in cure in more than 90% of patients.
Wow.
So these are really fantastic medications. They're very expensive, but they are available through a government subsidised scheme. So again, this is something that if you had hepatitis C, or you wonder whether you might be at risk of hepatitis C, you should certainly be going and getting tested. And if you haven't been treated and you know you've got hepatitis C, it's definitely a good chance to get into your doctor and have a discussion about hepatitis C treatment.
And I mean, 90% cure, that's a pretty significant shift or benefit to clients. Is there many side effects that come with having that drug, or is it it's a pretty good drug?
The side effects are almost zero compared to the older medications. So, I mean, these new medications have really revolutionised hepatitis C treatment. So, if you're one of these people who maybe knows they've had hepatitis C or wondered about it, or even someone who maybe has not had treatment in the past or failed treatment in the past, these new medications are for you.
Yeah, wonderful, wonderful. Well, Tim, it's been an absolute pleasure to have you. The information that you've given to us today has been amazing, and I'm sure that you out there have really enjoyed listening to the wisdom and some of the insights into gut health and some of the things that we can do to look after ourselves. So look, thank you for coming in, really appreciate it, and thank you everyone for joining us. We look forward to seeing you the same time, 12:30 next Wednesday. We've got an incredible interview lined up for you. Have a fantastic week. Remember, healing is a gift, health a responsibility. See you next week. Thanks, Tim.
Thank you.